This video will guide you in cleaning your FCS2 white top. Bioptechs suggests that after every experiment has concluded to break down the chamber when possible, not leaving any perfusates to dry out in the chamber, optical components, or tubing. Disposables can be discarded. Items that can be cleaned should be done at this time following manufacturer's guidelines. Sterilization should occur after cleaning has been completed. You can flush the chamber after the experiment with distilled or deionized water into a waste flask. Remove the electrical connector by sliding the lock to the left and then lifting off the chamber. Next, rotate the knurled ring counterclockwise to loosen the chamber. Once the forepaws move into the recesses of the white top, you can flip the chamber. A slight push on the cover slip or microslide may be required to release the optical stack from the base or white top. Make sure the silicone gasket has been removed. Use a syringe with alcohol, then begin flushing the chamber perfusion ports. Left side and right side independently. We suggest 3 mL minimum per side to flush. Let alcohol sit inside the top for 3 minutes for initial sterilization. Flush with 5 mL minimum of deionized or distilled water per side. If there is a restriction in flow from side to side or resistance when perfusing with a syringe, it may be time to clean more thoroughly than just a wash, rinse, and sterilization. How do you know if there's a problem? When perfusing, you should see a jet stream of water or alcohol from the lower, smaller ports of the top. This left side port shown has no restrictions. If a port is clogged, you will notice a hindered or restricted flow when using the same force on a syringe as this right side port. When using a low dead volume top, there may be some additional resistance due to the restricted ID and length of tubing. However, you should still get a jet stream of water or alcohol, but less volume as shown here with a clear port. If there is a clogged port, it is suggested to sonicate the top in alcohol for 5 to 15 minutes, fully submerged. This will allow any structures such as salts, sugars, or blockages to hopefully be broken down inside the perfusion ports. After sonication, if you have compressed air, this can aid in the drying process or even dislodging particulates from the tubing. The top should be placed where the outflow of a port can be captured and not dispensed into the room. If you have a waste flask or paper towel, you could use this to help capture any of the waste. Using compressed air, it would be suggested not to go over 50 psi, but pressurize from the small port to the large port first for a few seconds or in bursts. Repeat this step to the other perfusion port from the small side to the large side. If both sides seem clear, you can then use compressed air from the large tubing to the small tubing. Now perfuse the port which was clogged using a syringe with deionized or distilled water and test the flow. If the flow is now normal, then you are ready to finish sterilizing the top by a short cycle autoclave at 121 C for 15 minutes. The top can then be returned to service. If there is still a blockage, as a last resort, it would be time to use a mechanical device inside the port. Start with another 15 minutes in the sonicator. Then, using a small wire or similar device, gently agitate and rotate in the port. Try not to push the clog all the way into the port. You are only trying to release any items inside it. Purge with air after agitation is complete from the small side to the large tubing. Now perform another flow check with distilled or deionized water. If the blockage has been removed, you are now ready to finish with a sterilization step in an autoclave 121 C for 15 minutes. Then the top can be returned to service. If the resistance cannot be resolved, then it is suggested to return the top to Bioptechs for service or a new top purchased. Please contact a Bioptechs representative.